Hi, my friends. It's been about a week since the rules regarding face coverings were introduced, and since then, my experience has been mixed. I see bandanas, homemade masks, surgical masks, scarves, all sorts, but they all help to prevent the spread of COVID-19. So, who isn't wearing a mask? Well, anybody with a genuine medical condition is excused. And other than that, we should all wear a face covering of some sort. Why? Well, I'm not going to go into the many reasons I hear quoted for not wearing a face covering because we'd be here all night if I did that. And the figures and information here are taken from the Office for National Statistics and Dr. John Campbell, who's a renowned and highly respected epidemiologist. Now, does a face covering 100% protect you against transmission? No, nothing short of a hazmat suit and a respirator will do that. There's simply a way to control the possibility of passing on infection. Hence, surgeons, dentists, doctors, they all wear them to protect us from them. Do they work? Currently, coverings are mandated in museums and cinemas, galleries, places of worship, as well as shops and food outlets if you're not eating in. And the figures from the Office for National Statistics and the tracking apps, such as the one I use from King's College, where they're working on the vaccine, currently show a daily infection rate of around 4,000 people. That's 1,000 up on last week's figure of 3,000. And it equates to 1 in 1,500 people, as opposed to 1 in 2,000 at the beginning of July. Now, we opened many sectors on the 4th of July, so the effects of that are likely to be just showing in the impact of the figures that we're experiencing now. And we're right on the edge of exponential infection. That is, as the numbers of infected grow, so does the rate at which they grow. Essentially, spiraling out of control. So currently around 6% of the population has contracted the virus, but herd immunity, the number needed to have been infected and developed immunity or vaccinated, is around the 70% mark. And that's enough for the virus not to be able to replicate and infect more and more. Though there is some debate at the moment about immunity after infection, the information is evolving as more tests are done on those who've recovered. And the rise we're seeing seems to be predominantly in younger people, which is surprising, but possibly due to the early message that went out regarding them being very unlikely to develop symptoms and the resultant socialising and the gatherings that took place on that information and that advice. And the likely reason is viral loading, and that is being exposed to the virus multiple times. So it's a snowball effect building into a strong dose, a heavy dose. And it's a risky position to put yourself in, but even more risky for the vulnerable people around you. And something that could go towards undoing the good work that's done by others. The price some are paying is high. Other than the obvious one, sick relatives can't be visited in hospitals, and care home residents are isolated from loved ones. Interventions are now likely to be on a local basis, such as we've seen in Leicester, whose people are this week moving towards slackening their lockdown after having a real impact on reducing the figures. And the progress of the virus there and those infected has been closely tracked by testing. In fact, 12 times the national average amount of tests to identify, trace, isolate, and prevent contact and transmission. And the government's new message is hands, face, space. Big fish, little fish, cardboard box. So These really are the keys. Sanitize hands regularly after contact with anything unknown. Don't touch your face and keep space. He said, touching his face. If you choose not to use a covering, then we would ask that you keep more distance from others, 2 meters or more at all times, and respect the fact that were you to be asymptomatic, so carrying but not showing the virus, you need to take double the care around other people and respect their space and the efforts they're making to protect you. And please consider wearing a covering at all times as recommended. I'm doing my best to protect you, and I'd be really grateful if you do the same for me. It's a pandemic. Nobody is immune or excused. Protect our community the best way that we can. Be safe, be kind, and please be careful.